My name's Michelle, and I'm AMSA Queer's Engagement Officer. Today, I am lucky enough to be interviewing Stephen Bates, the current MP for Brisbane and Australian Greens spokesperson for queer people and youth prior to our upcoming election. Thank you so much for agreeing to catch up for our very first episode.
Oh, nice. I didn't realize this was the inaugural episode. Happy to be on.
Yeah. It's a new project set up by Queer AMSA, just trying to educate and empower the med student population and other healthcare students. So we're very lucky to have you
Amazing.
on.
Oh,
Um,
no.
so into my first question.
Yeah, yeah.
So the the 10-year federal government action plan for queer health was initially discussed in May of 2022 and materialized late last year prior to the forthcoming election. You called the plan light on deliverables and funding and asked for, in general, some systematic reform, including removal of out-of-pocket expenses for gender-affirming care, expansion of access to IVF and other reproductive health programs, and greater access across the entirety of Australia. How do you think the current plan that the federal government have in place will not only affect our ability as healthcare professionals to provide care, but how accessible in general the care is to our patients?
Mm. So, yes, basically, the reason I said what I said about the plan was because that's how I felt about it. I feel like government's really good at talking, well, not always, but a lot of the time good at talking to the sector. And the sector's very vocal about what we need, what the community needs, and what the community wants. So to sort of see another round of consultation after this was sort of like, okay, like eventually we're going to have to start actually implementing these system reforms. We can't keep kicking the can down the road forever and ever. And so I think like the reason I like specifically talk about the system reforms, particularly in the health sphere around, like you said, the IVF and around gender affirming healthcare and everything, is because I feel like already at the moment in the health system there are so many people who fall through the cracks and who don't get access to the healthcare they need, and it could be like twofold is how I kind of see it. So number one is that the affordability aspect. So it can be really, really expensive. Not all these procedures or processes or whatever the right term is, are supported under the Medicare system at least. And then you've also got then the other element of it, which is the the sort of lack of awareness, I suppose, from maybe some people in the health sector, and maybe not for any reason of malice, but just because it's not something that is, I suppose, sort of widely taught or widely communicated with people out there. So it's good that this plan exists, and it's good that it happened. I wish it did not take the entire term to go through it. I've been advocating, particularly to the Assistant Health Minister, on this plan, particularly around the IVF changes. So it's good to see that some of those have been adopted by the government now going into this election. So that is good to see that there's some progress. But yes, for me, it's very just we kind of already know what we need, and so let's get on with the job of doing it.
Thank you for that answer. I think it's nice to hear some nuance in that. Yes, we're happy that things are happening and that we're slowly making small footsteps, but at the same time, queer people have been advocating for tangible change in the healthcare system for a long time. And it seems to be just a talking point at at certain points. So thank you for that. I'll move on to the next question.
Yeah.
Um, the Queensland state government recently directed that new patients under the age of 18 not be provided stage 1 and 2 hormone therapy in Queensland health facilities. That's at odds with expert consensus and other Australian territories. I understand that the provision of public gender services to youth in Australia is led by the states and territories. However, the federal government has announced a review into gender affirming healthcare led by the NHMRC, deliverable by mid 2026 or so. And the Minister for Health has urged Queensland to halt changes. What, in your mind, can the federal government do to ensure access to gender affirming healthcare for youth is maintained and is protected?
Hmm. Well, again, I think obviously that decision from the new state government in Queensland was pretty horrific and pretty disgusting. And we had actually a huge mobilization of the community, not just the queer community, but allies as well around it here in Brisbane, which was really, really good to see. that it's not something that people are just going to take lying down, and that because it affects so many people. If it's not affecting you or your family directly, you probably know someone who's in the queer community by extension, and so you will know someone that eventually will be impacted by this decision. And especially like the fact that it's like it's children's healthcare is what it is at the end of the day, and you can't just blanket ban it because of allegations in one field. Like the LNP would never do that for the banking sector or for any of the fossil fuel industry. But as soon as it's about queer people, apparently they are really, really concerned about that stuff. But so I suppose what I would be saying here is the review the federal government's doing, which was part of the Health and Wellbeing Action Plan. So it is good that that is happening because those standards, I think, are about at least a decade old at the moment, and there's been so much, well, advancement, I want to say, in the treatment and gender affirming care that it's probably good to update those standards so that they're a bit more up to date with the rest of the world as well. Um, Timing wise on that announcement, look, it probably could have been better. It sent a lot of fear through the community when the federal government announced that. My take on it is that they probably announced it when they did to try and fend off other states from doing what the Queensland LNP had done. And if that was the plan, it seems to have been successful because it seems to just still be Queensland that's doing what it's doing. But I think then this is another place where we talk about getting gender affirming healthcare into Medicare as a sort of as another route for this sort of stuff to happen. So that if the states do decide for whatever reason that they don't want to provide this form of healthcare, then there is another pathway that people can take through the Medicare system. They're not just necessarily relying on the willingness of the state government to be able to provide that service. They've got an extra path so that if this sort of thing does happen, there is another alternative that people can go through to be able to access the healthcare that they need.
Fantastic. I might actually skip forward to one of my other questions because I feel like it connects really well to what you've just
Yeah.
said. Um, so it's my understanding that the plan of the Australian Greens is to make gender affirming care a part of Medicare, investing about $15 million a year to cover out-of-pocket costs, um, which is fantastic. And I'm sure many people in both my team and in my cohort would be very happy to hear that. Um, how does that contrast with the investments into Medicare in the most recent federal budget?
In terms of investments into queer healthcare or Medicare in general?
Into Medicare in general. So, how do you think the impact that this new funding would have would expand um, the impact in general that the expansion of Medicare is going to have? If you does that make sense?
I think so. Because
Yeah.
it's when you said it initially, I was like, oh, I'm not sure there was any gender affirming
No,
investments
no,
in
there was
care in
nothing
the
in there
federal
was nothing in the
budget,
budget
unless
at
I
all.
missed that one.
There was
Yeah.
nothing in the budget at all.
Yeah.
Yeah.
I suppose, look, obviously they're sort of the government seems to be focusing a lot on the sort of new investments they've made in the urgent care clinics and with the tripling of the bulk billing incentive and everything like that, which is good, but again, it's not this sort of specialist healthcare that we know traditionally more marginalized communities actually need. Like it's good, all well and good and fantastic, and we should have a universal healthcare system that invests a lot in primary care. But it's also about having the nuance of that as well. So by bringing gender affirming healthcare into Medicare, it's actually, to me, I see it as a values proposition. It's about believing in that healthcare should be universally accessible and should be publicly universally accessible. And so bringing gender affirming healthcare into Medicare is a way to actually defend and expand the universal healthcare system, if that makes sense. So instead of maybe creating like, and maybe unintentionally creating more and more barriers to access through sort of limited specific funding into these areas, we should be investing in these areas because if we believe in the principle of universal healthcare and that everyone has the right to good quality healthcare in this country, which I think is a right that should exist, and I would like to think it exists, then we should be, and that's why we talk about these specific investments in specific parts of the healthcare system. So yes, we talk a lot about also tripling the incentive and bringing dental and mental health care into Medicare, but also sort of including gender affirming healthcare in almost in the same breath, I suppose, because it should, if we are talking about, yeah, providing good quality healthcare, it's about expanding the healthcare system to make sure that everyone is covered for every single treatment they they need, basically. I hope that answers it.
It does, it does. I think I worded that a bit oddly, so thank you for reading between the lines there.
No, that's all good.
Um, Going back to gender affirming care for children, are you worried about the effect the election could have on policy in this area, given that a majority of coalition senators recently sided with One Nation in a push for a parliamentary inquiry into the human cost of experimental child gender treatments?
Yes, in short, I think I think it's normal to worry about that sort of stuff, especially like with the example you just gave, like the coalition senators and these One Nation and those sorts of cookers do this fairly frequently in the Senate. Um, they move motions on this sort of stuff all the time, and we're usually able, well, we have been always able to defeat them. Thank goodness, because there's clearly more people with sense in the Senate than Pauline Hanson. But I think, yeah, it's all about like, well, you would hope so, yeah.
Yeah.
It's about, I think this is the thing. I genuinely, like when I say this, I don't actually think that people like Pauline Hanson or these coalition senators who vote in support of these things actually really care about them. I think it's just a really great weapon and tool for them to be able to use to divide and conquer the population. So, because I think they just jump from one fad to the next. Like 10 years ago, it was gay and lesbian people who were getting this, and now people largely deem that sort of discrimination unacceptable. So they've just moved on to the next letter in the acronym. It's pretty much what's happened now. And so now that they've sort of like people like Pauline Hanson and these other senators may think, oh, I probably can't beat down on that population as much now, so I'll just try for this one instead. And it's very frustrating and annoying that we seemingly have to go through this process for every single marginalized group, but that seems to be the way that the world works currently. But I think, yeah, definitely it's concerning. Like if somehow Peter Dutton becomes the prime minister and it is a minority government, he'll need the support of like your Bob Katters and your One Nations to be able to get policy across the line. So with them in the balance of power, things will get excruciatingly worse for for everyone across society, like not just queer people, I mean, especially queer people, but for a lot of different marginalized groups across society, our policy outcomes will get worse because, but, well, I guess because they think that there's votes in it and they think they can win some elections from it, which I am optimistic they will not.
I am also incredibly hopeful. It's pretty disgusting that people's lives and futures, especially young people's lives and futures, are being used as political talking points.
Yeah, exactly.
Um,
And if they
thank you.
really did care, they would just listen to all the science and research that says that gender affirming care is fine and should be invested in because it leads to positive outcomes and the regret rates are like minuscule at best.
Less than
So,
most surgeries. Yeah.
yes,
Like,
yeah.
yeah.
So it's kind of like it's like if you actually cared about the evidence and you actually cared about young people, you would be listening to the people that know what they're talking about and not just conspiracy theorists.
That's how you get the votes, right?
Yeah, apparently. Yeah.
Um, you guys have also advocated for adequate funding to address the whole of life health and welfare needs of the queer community. Protective measures which look after the whole person, such as like mental health care, substance abuse care, and the implementation of youth programs which aim to improve outcomes by targeting like upstream issues. I would consider measures like this to be in the long run cost saving, both for the healthcare system and for the patients themselves. And so, these wonderful things, how do you plan to advocate for these measures following the election?
Good question. Well, it's sort of the same way we've been doing since before the election. Well, this whole term really is meeting with stakeholder groups, meeting with the ministers, and advocating on behalf of and with community. So I also, in like my role in Parliament, I'm also one of the co-chairs of the Parliamentary Friends of LGBTIQA plus people. So that basically is a cross-parliamentary group. We have like myself as a co-chair, we have a Labour co-chair and an LNP co-chair. So we try to make it as sort of cross-parliamentary as possible. And we host events. We have hosted events this term that sort of bring in people from like the health sector, the legal sector, refugees, like all these different sort of um, intersections of the queer community, and sort of can sort of yeah try to build a bit of consensus in what we then all go and advocate to ministers about. So it's bringing those groups together in that space and trying to, I hate the phrase depoliticize because it's political, but try to make it as consensus based as possible so that we can advocate to ministers and as ministers or assistant ministers, whoever the relevant person may be, and sort of say, this is where the community's at, this is where the sector's at. We've been able to have this event and we've gotten lots of support for it. And like we try to make it so we can try and make it as little of a wedge as possible and sort of say, look, if you do this thing, people will like you for it. It'll lead to good outcomes. Like you said in your example, it can sort of lead to actual savings in government expenditure and lead to better outcomes, which in my brain is sort of the perfect win-win. If
No
you're a
brainer,
minister,
yeah.
you're spending less money and things are getting spent more efficiently and you're seeing better outcomes. So that is one way of doing it, but also sort of using what we have in the balance of power, like what we've had this term in the Senate in the balance of power. But if we get balance of power in the lower house, then sort of everything becomes wide open in my mind. There's then opportunities for like more private members' bills to potentially get up. There's more opportunity for more negotiation and for more bills to pass. Like when Julia Gillard was the prime minister in that minority parliament, it was the most productive one we'd had in the history of the country. So I think it represents an opportunity for not just more investment at the sort of like executive level in the cabinet investing in programs, but also a cultural shift of the parliament and legislative change as well. I think yeah, maybe I'm optimistic, but I genuinely think it could be like on the precipice of some really positive and exciting changes if we do end up in a minority parliament, which is very cool.
I'm also very optimistic. Yeah, I think a chance of making a real change are very, very nice this
Better
election.
now
So
than they have been. I
yeah,
think.
I would put it that way too.
Yeah.
It's just a very exciting time that we live in for young people. Um, my final question for you is more along a personal line for both myself and my colleagues. What do you think the role of the government is in supporting medical students and other healthcare professionals in improving their provision of care to queer individuals?
Ooh, that's a good one. I think there's opportunities around, and this is sort of just my bit of a superficial take from me, because I probably don't know all the details in this specific area. But I think there's definitely opportunities around education. So, like I sort of alluded to at the beginning, there may be, because this is sort of a part of healthcare that has traditionally been in the past avoided for political reasons. It's now sort of, I feel like there's lots of catch up to do, and there's lots of cultural catch up to do as well. So whether it might be like it's sort of during like university where it might be having like a specific queer health sort of branch or sort of what am I trying to say? What do you call it? Courses or things
Yeah.
like that that you do as part of your degree so that it's sort of so that people have the sort of basic knowledge. So even if they may not go off to specialize in that specific field or that specific health area, then they sort of at least have the understanding of, oh, I know that this if someone comes in from this community, this might be something to look out for, or this might be something to ask, or whatever it may be, giving people the tools to actually know what to ask, how to ask it, and what to look for, if that makes sense, as opposed to sort of just expecting, like you sort of you finish your degree and then you go out into the field and it's sort of like good luck to you and figure it all out as you go, providing people with those tools to yeah, to be able to, I suppose, yeah, have some more marginal and vulnerable, marginalized and vulnerable communities more sort of in the mind without having to sort of I'm explaining this so badly. Have it
No,
in
you're
have it sort of part of the core courses as opposed to having it as an add-on and a nice to have, I suppose is what I'm trying to say.
Mhm.
Um, but yeah, that comes from support really, especially in the university sector from the federal government. Like
Mhm.
it is a federal responsibility because, and I don't think we should just leave it up to individuals to be able to sort of do it if they can and if they have the means. This is where I think the federal government should step in and has a responsibility to step in to make sure that people are receiving education that is relevant to what they're studying so that it can lead to better outcomes, not just for the person who's studying it in terms of their own knowledge and fulfillment, but also for the community who that person, like in the health sphere, will be going out into and will be engaging with. And not just like the queer community, but the entire community as well. I think it would benefit everyone. So
I
yes, investments in education, in staff, in students feels like an absolute no-brainer.
I would agree, and especially given I think a lot of students think that if they're not going into gender affirming care clinics or psychiatry, they're not going to meet queer youth, and that's not the case.
Because we're
Everyone,
everywhere. Yeah.
yeah, exactly. It's gonna be something that happens in your day-to-day life. If you're a GP, you will speak to transgender youth, gay
Mhm.
youth, lesbian youth, asexual youth,
Yeah.
and it's just
A
so
part of the
important.
deal.
Yeah, exactly.
Part of the rule.
It's part of the world that we're being trained to engage with. So it's a bit disappointing the lack of curricula for most unis at this point, I would say.
Mhm. But things can be moved and changed. That's what I mean. I sort of think like a lot of these sort of positive changes that we talk about in not just in this part of policy and politics, but broadly speaking, I do find change is a bit inevitable. It's really just the speed at which it happens at the end of the day. Whether or not people sort of jump on board straight away, or it takes like a few decades to convince people to get on board. But yeah, there's a phrase that goes something along the lines of the arc of history bends towards justice. And sometimes from where you're standing, it can look like a straight line in front of you, but usually throughout history, it has bent towards progressive change. There's sometimes it takes a lot longer than I would like.
I like that. I'll be using that one.
Okay, go for it. I can't remember where I heard it from, but it popped into my head again like a month ago, and I've been using it all the time.
Yeah,
So
I'll have to have a Google.
yeah.
All right, that was my final question. Is there any wisdom that you'd like to impart on me in these
Oh.
couple final minutes? Anything else you have burning that you would like to say?
Not that I don't think I've already said. I mean, I think that yes, there's a lot sort of going on in the world at the moment that is very overwhelming. Like you look at what's happening in America, and then with sort of like Dutton here trying to mimic things and just throwing the word woke into every single conversation that he can possibly have because I don't know
The
why
trigger
they,
word. It's a trigger
yeah,
word.
it's a
Yeah.
trigger word for it. Because he thinks there's votes in it or something, but
Mm.
we've never made progress as a society by dividing and conquering and punching down on people. Like eventually people have an inherent level of dignity, and eventually people will break. And I think that it's part of the role of sort of the progressive side of politics, and especially if there is a progressive minority parliament, is to actually build people up and provide people with economic, health, and social opportunities to feel empowered and to build themselves up as well. And so I think that we're sort of on like I said, I think we're on the verge of potentially what could be a really, really exciting time in Australian politics, where if we do end up in a minority parliament, then yeah, the door is blown wide open for what can happen and what changes can happen and the speed at which they can happen. So I still remain, despite everything that is happening in the world at the moment, I still remain optimistic that we can make positive change and that we will make positive change because we have no other choice but to make positive change. No one is coming to save us. We are the people that will have to save ourselves. So
Yeah, that's it's very nice to hear some optimism with everything going on in the news right now.
yeah.
You've
Yeah.
inspired me.
Yeah. Oh, that's good. That's what I'm trying to do.
Um, Thank you so much for your time. It was lovely having you on for our inaugural episode. Um, and hopefully we see you guys in Parliament
Yes. Thank you.
following the
Yeah.
election.
My
Um,
pleasure.
yeah, thank you so much.
Thank you.